I'm Dr. Naveed Mughal. Today we are having with us a very special guest, Professor John Murtagh, who is the pioneer of general practice in Australia and also known as GPCO. We would like to ask few questions from Professor Murtagh about general practice in general and would like to seek his guidance towards the establishment of general practice of family medicine in Pakistan. With me are my two respected colleagues, Dr. Yusuf Haroon, who is the Deputy Chair of RSCGP Victoria, and Dr. Majid Naeem Gundul, who is the Chair of IMG Committee RSCGP Victoria. Before we move forward, I would like to introduce Professor John Murtagh. Professor John Murtagh is a renowned emeritus professor, is an academic general practitioner, professor fellow of general practice at the University of Melbourne, adjunct clinical professor in the Graduate School of Medicine, the University of Notre Dame, and a guest professor at Peking University Health Science Center. He is also a highly acclaimed author of several internationally adopted textbooks, including John Murtagh's General Practice, which has been translated into 13 languages, and it is available in both hard and soft copies.
Thank you, Dr. Naveed, for that very kind introduction. I'm very pleased to meet you people and very pleased to have the opportunity to talk to you. It's a great honour that you've given me to talk to you about primary health care and general practice, whether it be in Australia or Pakistan or anywhere in the world. We all have a very common problem, and that is to serve our patients.
Professor Murtagh, what is the general practice and what it means in terms of healthcare system of a country?
Well, general practice is very fundamental in a country. It is very important. It really is the point of first contact of people, anyone in the community, particularly families and people who are sick. It's a point where they can go to and get help at any time. You ask about general practice. I have a quote, a very important quote from a very famous physician called William Osler, and he said this, and it's very relevant. It cannot be too often or too forcibly brought home to us that the hope of the profession is with those who do it, the daily work in general practice.
Indeed.
So it's very, very important for the public out there. They have somewhere they can go to and get expert care, whether they have a minor problem, whether they need to be immunised, whether they have trauma, but just a place they can go to and get expert care. So what are the principles underpinning it? Well, as I see it, the important principles, as we said, are primary care, yes, comprehensive care, which covers a whole lot of problems. It's family care, and that's important, a place where the family can go to.
Indeed.
It's domiciliary care, more important in the country where doctors can visit the home or the roadside, for example. Continuing care, where there's a constant care for people, so that they can be followed up from the primary problem. And really, it's all designed to achieve preventive care.
Professor John Murtagh, how a system of primary health care centered around general practice can be developed in a country like Pakistan? What are the key learnings we can have from Australian health system which can be applied in a system in a developed country like Pakistan?
Well, first of all, you need a commitment at a very high level, at a government level, who understand the workforce requirements and can determine where the healthcare is necessary. The focus, whether it's in the cities or in the country, and basically they can set up centres all around the country where they feel there is a need for primary health care. So the government have to look after workforce issues and identify the key points. Now, the key points in any healthcare system, of course, are prevention, which means immunisation. We have a commitment to combat infectious diseases. That's a primary identity that the government must understand. But also, you need well-trained doctors. That is fundamental. So it's a matter of getting a network set up, whether you have, as they are developing in China, they're developing healthcare centres for starters, and encouraging doctors to work in there and then extending that on a grander scale. It'll be slow for a start, but then we'll have to develop from there. So it's a combination of the government, the medical profession, and I understand you have medicine and surgery very well developed in Pakistan, and that'll have to extend to primary care physicians who are fundamental. They've got to be at the grassroots level. So you have to have a training program, and it can be from the medical schools and from the physicians and surgeons who will start it off, but then you need the primary care system. You need a general practice system which the doctors can set up so that doctors can be trained in primary health care, so they have a comprehensive training and can cope with most situations. So this means a system which is quite a sophisticated system of making people expert at primary care level. And it also means having a fellowship in general practice, which needs to be developed. So you have to set standards, and that can be set by the doctors in Pakistan who understand the system, know the standards requirement, and not only train the doctors, the young doctors we do in Australia, but to have an assessment method leading to a fellowship where they get a specialist qualification so they can be on equal terms with, say, a physician and a surgeon in terms of understanding health.
Thank you, John. I think that's a very important point, that it's a staged process, which will of course take some time. And I think it requires the government commitment as well as involvement of all the stakeholders to actually support the system to be established. Thank you, John.
Hi, Professor Murtagh. What is your message for education and training of primary health practitioners of tomorrow?
Well, I think the first thing is to have a national policy where the government and the medical schools and the specialists encourage this. That it is fundamental that you have a good primary health care system that feeds into the secondary system. So they have to encourage this, and there are certain primary physicians out there already, and they must be developed and encouraged to educate. And that means sending people who want a career in this part of their practice to go into these practices and learn from them. There has to be a very fundamental core knowledge. People must go into practice really knowing their stuff, and this is probably where you need good education, where you need textbooks, but it's not only textbooks, you need people out there to encourage it and teach. And the best way of teaching, I think, is the apprenticeship model, where they go into the practices to learn from experienced people like yourself, and they're there, so they go and learn about it. So they develop that core knowledge, and they get a pride in being the doctor of first contact. It's a very special calling, and I think this is what needs to be developed.
Thank you very much, John, for that wonderful advice, and I'm sure people will get benefit from this expert advice. Thank you very much.
Well, to follow on from that very important question, my message is the College of Physicians in Pakistan to take notice of the words of William Osler and other outstanding educators to extend education to the primary care doctor, to encourage it, because you have the knowledge and the expertise, and you can pass that on to the primary care doctors. Like the people we have in here in the room, there's Dr. Naveed, Dr. Yusuf and Dr. Majid, who are very committed, and they're here for a reason. That is because they're very passionate about setting up primary care and general practice in their own native country. It's a very altruistic calling, and I know they've put a lot of work into it, and they have developed an expertise in this, and I'm sure they can pass on that knowledge, particularly on the methodology of teaching and developing primary care networks in Pakistan.